Hi, everyone. It's DocTalk. And DocTalk this week is going to be about infectious diseases that are in the news that are not COVID. How about that? Something new after a year and a half that we have to really talk about other infectious diseases because so much is going on in the world right now. And the last week after my last DocTalk, there's been a lot of chatter really about the other infectious diseases. So let's walk through and gain some confidence in what we're doing and how we're doing it and how we've done it for a long time. Recall, every time I do an infectious disease presentation for medical students, for nursing students, for any of my EMT or paramedic students, there's always a message that you have to put up in front. And that message always is, we have great immune systems. As human beings, we're built to really be exposed to a lot of stuff and be protected from it. And it is concerning to everybody that you can't have bugs around you. And that's really not the truth at all. And every day you're exposed to tons of stuff that you've never even known about your whole life because you're well protected from it. So we have respiratory protection. We have protection in our GI tract. We have protection on our skin. We have protection all the way through our GI tract. We have protection in other important areas of the body, we'll put it that way. And it takes quite a bit to overcome your body's ability to protect itself. So with that in mind, when you hear about infectious diseases, you go, yep, I'm going to do a good job protecting myself. But my body every day does a really good job protecting me. And then number two is you cannot sterilize your way to a healthy immune system. And that's for you and for your children and for your grandchildren and others you're exposed to. Children have to be exposed to bugs to build a healthy immune system. And so we have the opportunity still to let our children play in the grass, play with each other, get exposed to stuff. Frankly, it builds a good immune system. When we don't let children get exposed to each other like the last year and a half, 2 years, it's really not as healthy for them. And as they've come back together now, and as all of the preventive measures have been relaxed a little bit, they have been catching respiratory infections. So really the biggest infectious disease news of the week is children's respiratory infections are very, very, very much ahead of the season. And whether it's RSV, which is really the bad little respiratory bug for children, particularly for infants, RSV is very high compared to other times in September and October. We have other viruses causing colds and coughs and runny noses. And on top of that, then ear infections. We have strep infections. And a couple of weeks ago, I told you about, as the kids were going back to school, every year they spread lice to each other. And that's just the way it is. There's a little bit of MRSA and a little bit of impetigo, which is another staph-oriented infection. And we see those every year as school begins. No relationship to a pandemic whatsoever. So our children's hospitals are very busy right now across the country. And they're picking up on a variety of respiratory illnesses, not COVID. Also, the news came out this week that many children that they have tested have antibodies to COVID. This unusual virus, the COVID virus, affects elders much more seriously than children. And many children have been exposed and have built antibodies to COVID, even if they have not been vaccinated. And it requires some specialized and relatively expensive testing to do, but they can figure out within your antibodies if your child has been vaccinated, whether they have been also exposed and built an antibody response to an infection that they got that you may not have realized, that they may not have realized. So it's been low acuity symptoms in children. Many of them have antibodies. Frankly, and my advice still to children is go ahead and get them immunized. And eventually it will become part of their routine immunization series, is including the COVID-19 vaccination. Okay, so respiratory infections in children. Number two story in the news is Ebola. a strain, a variant of Ebola has become a problem in the country of Uganda in Africa. Uganda has porous borders, so people in and out, and they're concerned that there's been enough spread in Uganda, and there have been deaths in healthcare workers and others, that they would have a chance of getting out of that country and that Ebola will spread to other countries. The number of cases has gone up over the last couple of weeks, so the international community has been activated. And in this country, they have begun to screen anyone who's been in Africa anywhere near Uganda. There are 5 locating centers in the United States where people who have traveled from Uganda will be screened through. And for all of you who work in those communities, you'll be aware of it because the CDC quarantine station at that airport will be doing screening. And if there's any potential, there will be EMS providers. In my old role as medical director for the Atlanta airport, we routinely would know about outbreaks in other parts of the world of different diseases and would be aware that we may be called, and we were called to transport patients, in which case we did it safely. As the medical director, I built the protocols that we use to protect our members. No one ever got sick from that. Out in other communities, it is worthwhile just to ask in your routine travel history, which you're taking anyway, for someone with a potential infectious disease, have you traveled anywhere in the last month out of this area? And if somebody said, yes, I was in Uganda, I was doing relief work, you'd say, I've heard of that country. Ebola is a concern. Are you concerned about Ebola? Have you been tested? Have you talked to your doctor? So across all of our country, that would be a wise kind of routine. And for infectious diseases, we still be getting 6 feet, we're getting our interviews 6 feet away from the patient. And within that 6 feet, that protects you from Ebola or from anything else. People are traveling now. I recently seen some patients with TB, tuberculosis, that has come from exposure in other countries. They traveled back to America, developed a different kind of respiratory infection, and are coughing up blood. That's a pretty high indicator of tuberculosis. Yes, I was doing work, or I was vacationing in an area that has tuberculosis, and I'm concerned about it. And so those are the kind of infectious diseases that we are protected from every day by using our routine PPE, by starting our interviews 6 feet away from the patient, asking them about their travel and exposure history. And then if they give us an indication that they have an infectious disease that may be infectious to us, we say, okay, we're going to protect ourselves. I'm going to keep my other crew members away. We've been through this over the last 2 years very frequently. Okay, monkeypox, another bug. So it's a pox virus. The frequency of it in this country is now decreasing. We still have our at-risk populations, and it has not been spreading widely outside of the most at-risk populations. We have not had a significant number of deaths, and we are getting very good at being able to identify people at risk, immunizing those around them, and then treating them for monkeypox so that they're no longer infectious and at risk to other people. As we move into the fall, recall we have a lot of allergies, and many people with respiratory symptoms now across the country are having allergy problems. And those are sneezes and sniffles and runny eyes and red eyes. And some people it induces wheezing. So we're seeing that time in the year when allergies and the storms that are moving through are blowing a lot of dust and allergens into the air. And so we're prepared for those and do this drill every year. As we move into the colder weather, though, and we move more people indoors, particularly in the northern parts of the country, it will be time to spread other viruses. The one we're worried very most about now for the country is influenza. And we've already had a couple areas in the country where influenza has hit a higher than usual number of patients for this time of the year. What does that mean? We have influenza A and a little bit of influenza B that have been identified in communities. Texas is one of them that has been on the high end of numbers of patients and spread. And influenza A has been the predominant strain that's causing the flu. That's respiratory symptoms, fever, muscle aches, and sometimes a little diarrhea. So symptoms not dissimilar from COVID. And then frequently people are swabbed both for COVID and for influenza, and they find influenza. What can we do about that? Well, we are protected as always with PPE. So in patients with respiratory symptoms who were called for in the 911 system, we're wearing our N95s and we're giving a mask to the patient, a surgical mask, and asking them to wear it in our presence. Number two, we can get vaccinated, and the vaccine contains 4 types of influenza for this year, predominantly the A strains, and the A strains are the ones that are mostly circulating right now. In October is the right time to get that immunization, and it will carry you through until the end of flu season. Occasionally, people without as good immune systems will get an immunization now and then can get another one in about March and be protected for the tail end of the influenza season. So far, we look like we have a good match. The strains that are circulating in this country now are matching the strains that came from the Southern Hemisphere during their winter, which just ended. Those are what we have prepared for with our influenza shots for this year. And so for those of you who don't usually get flu shots, this might be a really good year to get them. And I know I'm going to get mine in one arm, and in the other arm, I'm going to get the booster, the updated booster for COVID. But flu is circulating. You should be aware of it, and it will result in more cases that will come through EMS for ill persons, for respiratory symptoms, or as many of our cases of flu present here, you have someone who's a little compromised. They've got a bad heart, they've got a bad gut, they've got COPD, they get influenza, and it really tips them into where they get very ill. And we get a sick person call, and you get there and they're pretty darn sick. And then when you get the report back from the hospital, it says, yes, they were flu positive, COVID negative. Okay. So that's what we're preparing for as we move into the fall. Some of you are going to be dealing with snow and ice soon if you haven't seen it already. And I saw on the Weather Channel today some pictures of some snow coming through. And no, in the northern states, there's going to be a really cold blast coming through the next couple of days. So we are preparing ourselves, and we'll prepare our communities, and we'll prepare our fire EMS systems so that we're ready to go for the winter. So DocTalk this week barely talked about COVID, and we've had other things in the news that justifiably are there, and things we will protect ourselves from as we have in every other year, and realize that COVID is still circulating in the community. There's some predictions that we'll get a little bump in cases now. There's one variant in Singapore called the Xbb variant that is the next variant you'll hear about. And the reason that you'll hear about it is because it is more immune resistant. And we're still figuring out whether our current generation of vaccinations will protect us from that as well. Our other ones are covered by our current generation of COVID vaccines. So DocTalk for another week. Stay healthy. Let's get through to Halloween and have a really nice time with that, with our children, grandchildren, and others. Stay healthy and safe. Thank you.